Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. Hi, everyone. Today I'm speaking with Dr. Paula Gordon. Dr. Gordon is a breast radiologist, a patient advocate, and clinical professor at the University of British Columbia. She is the woman you want to talk to when it comes to breast health in this country, and you won't believe it, but not all women have equal access to breast health in this country. I hope you enjoy the conversation. Hi, Dr. Gordon. How are you?
I'm great. Thank you. How are you?
I'm really good. I think I should start by saying that we've known each other for quite a while through some help I've done with fundraising and through your work. And so I just want to confirm it's okay that I call you Paula right now.
Oh, please. Yes.
Because I'm only used to calling you Paula. I'm so happy we get to finally have this, long conversation about breasts and breast screening in Canada, breast cancer, where we're at, because I really feel like in the last couple of years, due to the pandemic, women's health, has we've taken a back seat, and we were already kind of taking a back seat when it comes to our own health because we're so busy looking after everyone else. What, in your work, what has the last couple of years been like for women's health?
It's been hectic. At the very beginning of the pandemic, we stopped doing any routine screening for about 3 months because we didn't have any PPE, the personal protective equipment. And so asymptomatic women weren't having mammograms, and only women with problems were coming. And even then, they were tended to be triaged to only women with urgent problems. So that's a few years ago now, and it's we're I think in British Columbia we're pretty much caught up with that. But all those women whose cancers were tiny and might have been picked up with screening, all those cancers got to grow a little bit during that 3-month period. But we're past that. Now it's, my personal focus is trying to improve breast cancer screening across Canada. People might not realize, but it's different in every province. And BC's doing an okay job. We could do a little bit better. But there's many provinces, for example, that don't even start letting women have screening mammograms till they're 50. And that's a big problem.
That I find that alarming. And I was just going to say to you, I don't even know what our guidelines are in BC anymore. I feel like over the years, there's been so many mixed messages in this country about you should go for a mammogram at 40 and you should go every year. Oh no, you should go at 50 and go every 2 years, or you should. When are women, in your opinion, when should women start going for a screening mammogram?
Okay, this isn't my opinion. This is science, and these are expert guidelines. And I'm going to change the wording a little bit. We know that you save the most lives if you screen annually starting at 40. Now, the phrase guidelines is complicated because there are guidelines in Canada from a panel that's called the Canadian Task Force on Preventive Health Care.
I'm not a doctor. I'm not an expert by any means, but almost every woman I know with breast cancer, and I know a lot, were under the age of 45 when they were diagnosed.
And this is actually something that you'll be interested in. In the last month, my colleagues at University of Ottawa worked with Statistics Canada, and they looked at the outcomes of screening, and they compared provinces that do screen in the 40s with provinces that don't. And no surprise, in the provinces where women can't have screening in the 40s, they're diagnosed with more advanced stages of cancer and less often with early cancer. But here was the surprise, not just in the 40s, but even in the 50s. So what you do in the 40s affects the 50s because, of course, some of those cancers that you could have found in the 40s that weren't screened show up in the 50s when they're bigger. And they've shown that since so the guidelines that I told you were first implemented in 2011, and they've shown that since 2011, there's been a 10% increase in advanced cancers.
I was just going to ask you that. What is the benefit of this task force? Like, what do So each province in this country they determine how they spend their healthcare dollars, and they make up the rules, if you will, of when you get a mammogram or a prostate exam or whatever it might be. Colonoscopy, right? All those things that we expect we'll get when we hit a certain age, or if we have a family history or something like that.
Except women in Ontario don't expect to go till 50 because they never have. So
What?
so women, you're speaking like a British Columbian when our screening program started in 1988, you're right, it started out every year starting at 40. Then that was 88. 1997, they said, well, women in the 40s can still come every year, but after 50, it's only going to be every 2 years. Then in 2015, they said, the only people who can come every year now are the women with a mother or sister, first degree relative with breast cancer. And that's not good because 85% of women who get breast cancer have no family history. So if we don't do annuals in everybody, the vast majority of women who are destined to get breast cancer won't have the same opportunity for early detection. And when it comes to breast cancer, it's all about early detection for 2 reasons. Number 1, you're less likely to die if we find it early. But also importantly, when it's found earlier, then women can have less aggressive treatment, successful treatment, which is a better quality of life. So, for example, if a cancer is found large, most women need a mastectomy. If it's found early, lumpectomy. If it's found larger and spread to the lymph nodes, women are more likely to need the big operation in the armpit called an axillary dissection, which has a 33% risk of lymphedema. That's when you get swelling in the arm and hand that's usually permanent, and it's life-changing. With early breast cancer, women can have a less invasive procedure instead called a sentinel node biopsy with a 2% risk of lymphedema. So that's a big deal. Also, when women are diagnosed with breast cancer early, they have genomic testing now that can predict the risk of recurrence, and some women get to avoid chemotherapy. So not only are you less likely to die, but you have better quality of life because you can have less aggressive treatment. So the mortality statistics are really striking. When cancer is found at stage 0 or 1, the 5-year survival rate is 100%. Out of 100 women, they're all going to be alive 5 years later. If you're diagnosed at stage 4, it's 22%.
So what's it about, Paula? Is this about money? Is it just about money? Like, seriously, it has to be about money. Are mammograms super expensive? I don't know, because I know that chemotherapy is very expensive for governments. I know,
and especially now with women living longer, and if they've got metastatic cancer, they get one kind of chemo, and if they do okay for a while and then it comes back, they get more chemo. So it's actually getting more expensive, the chemo. But it's not just money, and this is what's really insulting. The task force claims that they have considered the benefits of screening, and they call them the harms of screening. A better word would be risk. And the biggest risk they're concerned about is the anxiety that women go through.
I knew you were going to say this. I knew you were going to say this.
Well, I've said it before. It's everybody knows. So they say that women should be spared the anxiety of being recalled from screening for extra tests. When we read a mammogram, we don't just see cancers, we see cysts and other benign lumps and all kinds of things. And we want to be better safe than sorry. So we'd rather patient come back and have some extra tests. And 95% of the women who get called back are told, it's fine, it's not cancer. The task force says that's such a harm we're doing to women by causing them that anxiety. They're saying, let's not screen them, even though they know more women will die and more cancers will be diagnosed late. Yeah, so that's, most women say, whoa, is that ever patronizing? Tell me the facts and I'll decide whether I can handle it. What we do know is that anxiety is very real, but it's transient.
Yeah.
And women
It's
would rather
anxiety
go
that quickly turns to relief when you find out you don't have it. It's like, I mean, that I had cancer and yeah, I know all about, scans. What do they call, what do we used to call
scanxiety.
it? Yes. You're waiting for your scan to come back, and sometimes it can take, 11 days for your CT scan to come back or whatever. And those 11 days are pure torture. Of course they are. But if you get good news, that anxiety, I can tell you firsthand, it just slips away into nothing. What is really stressful and makes you very anxious is cancer.
And that's what the women would say, I'll take a false positive over a false negative any day. But not even a false negative. I mean, not even the opportunity. Because if you throw out the baby with the bathwater and you say we're not going to screen any of these women to prevent some of them from being anxious, we're also losing the opportunity to find those cancers which can be lethal.
Hmm. So, I'm sure there's a lot of people listening right now who are just as shocked and as I am right now. What can the average person do about it? I know you're constantly advocating about this, and I think it's fair to say this is your life's work. There's no doubt about that. What can the average person do?
Well, you're right. I am working with colleagues across Canada to try to fix that. But I'll tell you that the decision makers don't often listen to experts, but politicians listen to voters. And I say this over and over, and I know people just don't do it. You have to reach out to your elected representatives, not municipal, but provincial and federal, your MLA, MPPs in some provinces, your MPs, the health minister, the director of the screening program in your province. Write a letter, make an appointment. And that's how we got it done in British Columbia. BC was the first province to tell women whether what their breast density was. There's now 5 more provinces, and this is only because of patient advocates. The doctors have been talking about it for decades. When the women speak, the politicians listen. And we're also, British Columbia's one of only 2 provinces that where the women can get a screening breast ultrasound covered by provincial health insurance. BC and Alberta are the 2 provinces. So there's 6 provinces currently telling women all patients their breast density in their screening mammography report. Another 2 will do so in the coming months. But there's some provinces that only tell women in category D, the highest breast density category. And that's misleading if you're category C. That makes you think, oh, I don't have dense breasts, when women in category C do have dense breasts and do face those 2 risks. So the 2 risks of having dense breasts are, number 1, an increased risk of getting breast cancer, and number 2, the masking of breast cancer. So the likelihood that we'll see the cancer on a mammogram drops as women's breast density increases. And there are lots of tests now that can find the cancers missed on mammograms, but the one that's most easily accessible and cheapest and comfortable is ultrasound. Women at very high risk for breast cancer also get breast MRI, and those are typically the women who have the breast cancer gene defect or women who've had lymphoma and got chest radiation. They get annual MRIs. In the U.S., women who've have had cancer, who are breast cancer, who are diagnosed younger than age 50, they're recommended to get MRI. Women who of any age who have had cancer and have dense breasts, they're recommended to get MRI. And in the last couple of months in Europe, the European Society of Breast Imaging has recommended that all women aged 50 to 70 with category D breast density, that's the highest category, have a breast MRI at least every 4 years, but preferably every 2 to 3 years. Now, there aren't enough MRI machines or trained technologists or radiologists to read them. So in cases where that's not feasible, they say mammogram and ultrasound would be the alternative. So this is really a changing picture as more research is done and more evidence comes up. But the Europeans made that decision based on a big trial where they offered screening MRIs to a whole bunch of women, thousands of women with dense breasts, and they were finding 10 to 16 cancers per 1,000 women. So ultrasound finds between 2 and 7 cancers per 1,000. So MRI is the most sensitive test, but it's the most expensive. It's the least accessible. It requires an intravenous injection, and a lot of women can't tolerate it because of claustrophobia. You've got to lie in the MRI machine for 45 minutes. And if you've got claustrophobia, that's hard.
Yeah. So I'm still trying to comprehend that not all women in Canada have equal access to breast health. So I'm still marinating that in my head because it's shocking to me when I think about all the awareness we've done for decades for breast cancer. When I think about all the money that has been raised all over the world for breast cancer, for research, for awareness, for, better outcomes to save lives. So yeah.
So 17% of breast cancers occur in women in the 40s. Now, if you want to be a minimalist, you can say, well, 17% is in the 40s. That means most of them happen to women over 50. But that's not a fair way to look at it. You're looking at one decade of life compared to the next 3 or 4 decades. If you look at it by decade, it's about 17% in the 40s. I think it's a little higher in the 50s, probably highest in the 60s and 70s, and so on. No decade of life accounts for more than 25%. So it's not insignificant. The numbers of women in the 40s, the fact that even though it's less common in the 40s than, say, in the 50s, because women in the 40s are more likely to be premenopausal, their ovaries are still making hormones, their breast cancers grow faster. And the years of life lost to breast cancer for women diagnosed in the 40s is about 27% of all the years of life lost. So you said it at the beginning, women in the 40s are looking after young children. They're looking after aging parents. They're working and they're contributing to the economy. They deserve the opportunity for early detection. No test is perfect. We're not going to catch all cancers. Even if we started screening all women in the 40s, there are still women that get breast cancer in the 30s. We still have to improve treatments because breast cancer is not common enough in the 30s to justify screening all women in the 30s. There's some blood tests being developed now. Maybe that'll be the answer. Maybe that'll be good for younger women. We also are cognizant of radiation, and the radiation from a mammogram is negligible in a woman in her 40s. But, in younger and younger women, it gets more relevant. Mm-hmm. But wow, if one of these blood tests works.
Well, yeah, and that's what they do for prostate now, right? There's a blood test that you can get. So if someone's listening right now and they're like, I have no idea if I have dense breasts or not. I didn't even know I was supposed to know about that. No one's ever mentioned that. I've never read about it. I've never heard about it. Can they go to their healthcare provider and say, can you tell me if I have dense breasts or not?
That's such a good question because the only way you know is from a mammogram. You can't tell by doing a breast physical exam. Lumpy breasts are not necessarily dense. Both lumpy, soft, or rock hard breasts can be fatty or dense. And by the way, the opposite of dense is fatty. This is the one spot in your body you want to be fatty because you're at a lower risk of getting breast cancer, and it's more likely that we would see one if you got it. So you can't know until you have your first mammogram.
What if you go to the doctor and you say, I had a woman reach out to me and she said she doesn't have a family doctor, right? 6 million, isn't it 6 million Canadians don't have?
I heard it was 9. We're up to up to 1 in British Columbia, but I heard it was 9 across Canada. And that's a good point because in British Columbia, well, I want to make 2 points. although we're really lucky, we're one of 4 provinces that lets women start referring without a doctor's requisition, starting at 40. But in British Columbia, women are required to give the name of a family doctor or nurse practitioner. And if you don't have one, you don't get a mammogram.
And that's what this woman said to me when she reached out to me. And she has a history in her family, but she does not have, and she's, I think, 40, and she does not have a family doctor or a nurse practitioner. And she was completely astounded that she couldn't have access to a mammogram.
Yep. I've been in touch with the head office of the screening program saying, you need a workaround here. I mean, there are ways for health authorities to look after, they call them orphaned patients, the ones without a primary caregiver. We have to do it, because look at all the women that aren't getting screened because of that. And because of the confusion created by the task force and the guidelines, and it's different in every province, even though in BC, women can refer starting at age 40, self-refer, only 25% of eligible women are coming in their 40s in British Columbia.
Okay, so before I ask you some more questions, I just want to. We always like to give back, and it's on topic here where you're giving back. We ask our guests to choose a Canadian nonprofit to give $500 to in your name, and you chose Dense Breasts Canada. So we will be giving them $500 in your name.
Thank you
for your time here. No, thank you so much. Where do we go from here, though, Paula? To me, this conversation shows me that on one hand, we know so much. We know more than we've ever known about breast cancer, ever. We know the most now in 2022. But the other part of our conversation also points out that we seem to be going backwards when we're talking about the things that women should be doing in order to stay healthy and keep their breasts healthy. Every woman I know worries about breast cancer. Of course we do. We have breasts, they're right here in front of us, and we think about them all the time, and we look at them all the time, and we think about it because we know women who have breast cancer or had breast cancer. So how do we move forward, and how do women in this country support the experts who are trying to advocate for better health outcomes?
Well, you're doing a great public service by getting this information out there. I mean, there are risk factors you can't control, like your genetics, and there are risk factors you can control. For example, maintaining a healthy body weight. Moderate exercise lowers breast cancer risk. Minimal alcohol helps minimize breast cancer risk. Nobody likes to hear that.
No, they don't, especially in a pandemic.
Yeah, I know, but even a couple of weeks ago where they changed the guidelines and said 2 drinks maximum a week.
And we forget about our own health. And we are natural caregivers, and we are very good at taking care of everyone else. And then, I see it happen over and over and over again. I saw it happen with myself and many of my friends, where all of a sudden it's your health that needs attention. And, we do get too busy and we forget about these things. But we should also mention, Paula, that men also get breast cancer, and men die of breast cancer.
Mm-hmm. It's much, much less common. Only about 1% of breast cancers occur in men. And if it's not even on their radar, men don't need to do breast self-exam, but if they're just soaping their hands over their chest in the shower and they happen to feel a little bump, they shouldn't disregard it. It might be nothing, but they should go to the doctor and get it checked out, because yes, men can get breast cancer.
And I know this task force doesn't recommend self-examinations, which that just seems like a cruel thing to say. I do believe in self-examinations. I have 2 young girls. They're 12 and 14 now. When should women and girls start checking their breasts?
Probably 25, 30. I mean,
but you mentioned something about knowing what's normal for you.
Mm-hmm. Well, the first time you do it, you don't know if it's normal or not. You have to assume it's normal.
Yeah.
And that's why we want women to start young. But starting much younger than 25 or 30, there's puberty, there's all those changes going on all the time. Once you sort of stabilize into a pattern, having regular periods, and do your breast self-exam after your period, because if you're going to feel tender and lumpy, it's usually before your period. You don't want to check then. And realize that some women have lumpy breasts. That's just their normal. So the first time you do it, you can make the assumption that it's normal. And as you do it over and over, you don't have to make a diagram with where all the lumps are, but you'll just intuitively know whether that's just the way you usually feel. And especially, so, I mean, if we were intensively screening with mammography and ultrasound, breast self-exam might be less necessary. But because some women are not getting mammograms at all, say in the 40s, breast self-exam might be the only way they're going to find their cancer. If they're only being allowed to have a mammogram every 2 years, then what are you going to do in between? What if a lump popped up in that 2-year period? You want to not find it? No, that's hopefully a pathway to early detection. And even women with dense breasts, let's say a woman has a mother with cancer and she gets to go every year, but if she's got dense breasts, we know that it would be harder to find the cancer. It might go undetected. Do breast self-exam between your mammograms. And if you're doing breast ultrasound in between your mammograms, which is what I recommend, not at the same time, but alternating, then at least you're having more frequent checkups, if you will.
How many, because you're a radiologist and you've worked in women's health for so long, how many mammograms do you think you've read over your career? If you had to guess, if you had to take a guess.
I actually did this. To be a screening radiologist in British Columbia, you have to read a minimum of 2,500 a year. But I know that for over 10 or 20 years, and that's just the screening, that doesn't count the diagnostic mammograms, I was reading over 5,000 a year. And every time oh yeah.
You're kind of an expert. You kind of know what you're talking about. Kind of, yeah, kind of. Wow. Paula, what would be your dream at the end of this? Besides, for obviously our dream is for, no woman to ever get breast cancer or die of breast cancer ever again. But what do you hope happens in the next little while?
I hope we give more opportunity for early detection. I'm sorry, I sound like a broken record.
No, you need to.
Annual mammograms starting at 40. Tell all women their breast density. Let them book their screening mammogram without the name of a family doctor. And women with dense breasts having at least ultrasound. And as more tests become available, there are so many more tests being developed, and some of them are going to make a real impact. So just pay attention, and hopefully our health system will keep up with the research.
Well, all women are very lucky to have you advocating for us. So thank you so much, Paula. You are on Twitter, and your Twitter handle is that's Dr. Paula Gordon. Dr. Paula Gordon on Twitter. She's got all the information there. Thank you so much for your time, Paula.
Thank you, Tamara.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.